People always want to know what anyone. I'm saying you do it. You get it. I'm getting it. You come steady.
Spinning the hottest hits. It's Max Owasco. I get those goosebumps every time. Goosebumps every time. That's everyone doing. And it's 21, yeah, I'm riding.
Hello. Hello, everyone. Good morning. And so today we are entering at last day of our World Congress of Diabetes. And since last 3 days, we have done so many workshop on diabetes technology and more updates on diabetes type 1, type 2, and other diabetes. But today's session is very special, and today people with living with type 1 diabetes, they will share their experience and their roller coaster journey, and also how they are overcoming with this taboo of type 1 diabetes, which people always recognize as a weak thing if a person living with type 1 diabetes. uh, we being a type 1 diabetic, we oftenly visit to the doctors, endocrinologists, where they prescribe prescription medication and nutrition consultant, but there is a life beyond that. So for this topic, we would like to invite you Dr. Irina. She's from Ukraine and she is a vice president of International Diabetes Federation. Also, she is a person living with type 1 diabetes since last 32 years, and obviously she is a diabetes educator as well. And before that, I would like to invite Savita ma'am. She is a chairperson of our session. Please welcome Savita ma'am.
अरे आप कंटिन्यू करो, अच्छा नहीं लगेगा, कंटिन्यू।
And now I would like to invite to speak on topic living beyond prescription, Dr. Irina from Ukraine. Dr. Irina, over to you.
A very good morning, all. Welcome, Dr. Reena. Really glad to have you here with us. Um, could you please share a few words and guide us further for type 1 diabetes?
I see we have many people. Some of them maybe have already slept. My propose to you before we start speaking, let's warm up. Let's stand up and make little bit small exercise. Yes, thank you very much for introduction me. Yes, I'm pharmacist. I vice president International Diabetes Federation, but now I present people with diabetes. I have been living with type 1 diabetes 32 years. Cannot imagine. But my talk about diabetes distress living beyond prescription. First, we start from terminology. Little update your knowledge. Distress, what this is: emotional, social, spiritual, or physical pain of suffering that may cause a person to feel sad, afraid, depression, or lonely. Diabetes distress is the emotional distress resulting from living with diabetes and the burden of their relatives' daily self-management. People in distress may also feel that they are not able to manage, of course, these changes caused by normal life activities or by having this disease, such like diabetes. And a small fact about diabetes distress. Severe diabetes distress affect 1 of 4 people in 4 people living with type 1 diabetes, 1 in 5 people with insulin-treated type 2 diabetes, and 1 in 6 people with non-insulin-treated type 2 diabetes. The greatest diabetes distress is associated with suboptimal diabetes self-management, HbA1c, and impaired general emotional well-being. Diabetes distress is sometimes mistaken for is more common than depression, and diabetes distress is best managed with the context of diabetes care. From my experience, the greatest psychologist burden in the diagnosis is time in diagnosis in diabetes. When I go back to time when I got this diabetes, yet I only finished my university, I have plan, I have dream, I have another strategy for my life. Suddenly, I got diabetes. People who have diabetes understand very clear what this. It's shock. You cannot accept this, and it takes time for acceptation this disease and how you can manage this. This is, I think, it's very, very important support in this time. And I'm very happy and lucky I have parents who full support me and do everything even which is not possible. And if another part of burden of diabetes which we feel in every day is hypoglycemia. Sorry. For me, it's like I all the time afraid hypoglycemia. In this case, I maybe not super control because I have little bit higher, and be sure that I am not go to hypoglycemia, because hypoglycemia absolutely destroy day, and you feeling you have plan for one day, but you cannot manage because hypoglycemia. In this case, it's a big problem, and then it's like you work or you live under the something in your head all the time. There's also big distress. But self-management. What is key words for beginning when I got this disease? I was very lucky and had in that time, you can imagine, we had one educator session school, self-management school. It's for everybody, not like now for type 1 diabetes, type 2, young children, adult difference. This is everybody together. But after this school, I understand that I can manage diabetes, not diabetes manage me. In this case, it's I think it's important education more of ever. But it was all the time perfect or not. Be sure nobody perfect, even if you want very much. We are in real life, we are real people. We sometimes very tired from everyday manipulation and injection, and sometimes I even don't remember I did insulin or not. Not because I have bad memory, thank God now I still have good, but because it's routine. And it's like automatic. And this is also we feeling sometimes not comfortable. It's I have already done insulin or not. It's a lot of moments which we feeling and feeling it's not so good in our life during day, during night, because it depends of our situation, what we do, what happens with us, what is party, not party, something like that. But as I say, I'm lucky, and I had this course, and diabetes became part of my life. I accept this disease, and I understand that I must manage. And of course, it changed my life, and I must be friend with my diabetes. I'm not alone, but I must be friend with my diabetes. And what is positive view on diabetes? I try to find not only negative, because it's terrible disease from my side, but in same times it's new opportunity, because you meet some people, you start involved in some activity which before you never thinking about. And I was lucky because we have a local association which was I was involved in the activities, and I very happy. I forgot about diabetes because it was good emotional. We not speak too much about diabetes. We live, but in surrounding which everybody understand each other, same have some problem, and even somebody start say something crazy and say, "Oh, you have hypoglycemia." Maybe it's like laughing on this. It's like joke, of course. And I really involved in our association, and we organize some camp for children, for young, for adult. You see, this for adult is education camp, and you see how people happy, even who has diabetes. Another case is also positive view. I never thinking that I will be full involved in football, but not like player, like manager of our team. And 2012, we created one great project, football competition between people with diabetes, only for people with diabetes. And it was start from 8 countries. It was first in time in Kiev, and now it's grow, and now it's 21 country involved. In every year we organize different country this championship. You cannot imagine how improve life of our players. They come and will be shy, but after their few months in the surrounding, they're very strong. And also another case, they understand for play great play football, you must have good condition. In this, they try to be under the control all the time. And about my career, I put my career to through this diabetes, and I organized 2003 first diabetes day in a pharmacy, and now it's successfully prolonged. Till now, I'm not involved in this, but it's start very great day, 14 November in chemistry. And now, as vice president, I collaborate with International Pharmaceutical Federation, and we make development some tools for pharmacists, and because pharmacists can assist doctor and make better outcome. But it's not only we have diabetes. Suddenly something happens, tragic, tragedy that you cannot imagine, you cannot expect, and you cannot prepare for this. 24 February 2002, Russian attacks across Ukraine, and that happens like humanitarian crisis. To be honest, I never forgot when my friends called me and said, "Wake up, war start." We cannot believe even. But unfortunately, and this is a big stress, because we people with diabetes, we need insulin every day, and we don't know what happens, because from beginning of war, our system was reimbursement system, which we got insulin from pharmacy broken. People could not take insulin through the pharmacies because they could not deliver in there, because pharmacies did not allow program. We have a program affordable medicine. A lot of distribution were encouraged to go to those places like they were shelling. Insulin was in storage of all company in warehouses, but there were problems with delivery. But in same times, we can see how people can help each other, and how many international association, individuals help to us, and we can see solidarity, and we really family. I really have chance to say everybody who helped us, thank you very, very much. We really appreciate this. And I, like Vice President, decide use my connection and the power for organized some communication between IDF and Direct Relief, its main organization who deliver some supplements and they deliver it to Ukraine. And to be honest, we have not big problem. And now it's okay if not next to front. It's system work and people have insulin or tablet. And how, but you can imagine what is stress and how I can manage. I try to do something else. And I go to trainer, but it's not interesting for me. It's only routine. And what I see some advertisement. Welcome to ballet, which I never do before. And I go and I got a lot of enjoy, and it's like change my mind. And this is absolutely great opportunity to fighting with this stress. It is very good. Do something new. And another case, what is positive from this, that many people try to help us, and we organized a London to Kiev charity bike challenge by Jerry Gore, maybe someone know his, and it was also show that we can be family, and he take with another groups took 3,000 kilometers from London to Kiev and collected money for some hospital. And what I would like to deliver for ending, that for people with diabetes, you must control your life. Depends of your wishes. Please don't stop in your wishes. Go to goals. But for doctor, please support. We really need your support. We really need your treatment, and be tolerance for if sometimes we not follow for your recommendation. And this I only want to last point. The challenge is new opportunity. I celebration 20 and after this 30 years with diabetes. On mountain it's like you can imagine 10 kilometers up and 10 kilometers down. And thanks God I have good condition. Thank you very much.
I thank Dr. Irina on behalf of all of us for taking us through her inspiring journey of type 1 diabetes. So I think we all have been through this phase from denial to acceptance to happily living with type 1 diabetes. Thank you, Dr. Irina, for further guiding us. Now I would like to request Dr. Tahir Hussain to please join us on the stage. Dr. Tahir is MBBS and MD in pharmacology, founder of Rehai Healthcare, worked in pharma medical affairs in oncology at BMS Roche, critical care physician, worked at AMRI Hospital and Besson Hospital in Kolkata, working as integrating AI in clinical practice, and he's also an IDF speaker. Most importantly, he's living with type 1 diabetes from last 24 years. Welcome you, sir.
I always wanted to be a pilot when I grew up. Someone who reaches new height, navigates through turbulences and stay focused on the destination. But life has a strange way to throw turbulences in our way. Imagine flying at 40,000 feet, you hit a storm you never saw coming. No manual, no warning, nothing. Just you and the challenges ahead. I faced these turbulences, but not in the sky, in my own body. Good morning everyone. Good morning Savita, to introduce for a nice introduction. I am Tahir. I come from a small town, Malda, in the sweetest part of India, West Bengal, where in 90s kid, I mean a middle class 90s kid, education was the only way to success. And at that time we have two runways, medical or engineering. At the early age of life, I learned that successful dream should be practical. As my journey took a surprising turn, I also learned that along with practicality, you have to be resilient too. However, over the years, I discovered that thriving in life, despite challenges, boils down three fundamental principles. I called them 3R of navigating those challenges. I was in grade 11. It was the holy month of Ramadan. Although I was not new to fasting, but at that time it was something different. All I want was to eating. So as some other symptoms was also there, I discussed it with a local physician. And luckily, after some basic investigations, I was diagnosed, unheard term at that time, type 1 diabetes. Along with my mother, here my mom is. Along with my mother, we went to senior consultant of that town, and I overheard the communication between the doctor and my mother regarding my future and my lifespan. I clearly recall those terms till days. The doctor was advising my mom to keep under strict routine and a close observation. I was in a small town. At that time, I was not ready to hear all those, restriction at the age of 15. I broke down. I broke down, hoping things would change. Along with my mother, roam around the local healers, those babas, sadhus, maulabis. Nothing happened. Situation worsened. I put on insulin multiple daily doses. My student life, definitely along with others also, lot of challenges. Hostel life, I move out to home, irregular food, exam stress were few of them. The biggest challenge I had to face is fighting against social stigma attached with it. I had often faced prejudice and the negative judgment of the people based on some misinformation about the disease. There were questions raised about my basic instinct. Number one, whether I can earn, I can have a career, I can have this food, that food. And number two, my reproduction capability. Whether I can have a girlfriend, I can marry, I can have kid. Forget about thriving. My living is questionable at that time. All this starts affecting my mental health as well as confidence. Imagine a boy who topped in the school are now hiding from the people. I was desperate to come out of the situation. Although I mostly surrounded by the friends and relatives who believe in stigma and all this misinformation attached with it. But there was somebody who really want to help me and care about me. These people, they help me to develop a coping mechanism to fight against people. These are some of those people who really care for me. These are the people who consider me as the normal human being, not the conditioned one. I selectively choose these friends when I started staying in the hostel in my medical college, that is NRS hostel. That is one of the eminent college of that Kolkata. Those who are from that college can correlate my room at ground block, room number 56. That was my war room at that time. And beyond this support system, one gentleman was there who watched me silently. Professor Salil Pal, he was also endocrinologist at that time, working in the medicine department as a professor. He never wrote me a prescription. His wisdom was beyond that prescription. He guided me slowly that I never lost my way. This is the time when I learned the first principle of thriving in life. Reach out and find your own people. I quote the Zen term here, find your own tribe more specifically. When we are facing challenges, facing it alone is not the answer. We have to find a support system, what we did at that time. And with that support system, I completed my MBBS with flying colors. Now my question to you, have you ever reached out to anybody for help when you reach the lowest point in your life? If not, think about it. It's mandatory. While I crossed the first milestone of my medical journey, I came across another reality of life. I started my internship, my first rotational posting on general surgery department. So one such admission day, generally admission day is 24-hour shift. One such night I had a convulsion, probably hypoglycemic. I had to admit in the hospital. And after that episode, the authority never allotted me a single night shift duty in entire internship journey. That was the best thing that can happen for an intern who is working in a busy government hospital. I was also happy at that time. But this best thing put a limitation at my growth. Whether I spoke with my mother, with my father, with my parents, or spoke with any senior teachers or professors in my institute, all the advice I do receive at that time at the space, you have a limitation. I reached a stage where I believe them, but I feel suffocated. The consideration I was receiving mostly disempowering me. I do realize everyone is best at their heart. They all are caring for me. But all this I felt is restricted in life. I had to keep myself distracted from my home. I want to find my own system there outside my home. Now when my teachers, after completing internship, my teachers suggest me to take a government job, take a suburban posting and enjoy a cool life, I opt out. I joined in ICU in a city, in a big corporate hospitals. When I complete my post-graduation, again my well-wisher suggests me to join medical education service. I mean teaching job in medical college. That is very relatively cooler life. Again, I opt out, join pharma medical affairs and move across the country and the world. But all these were keep on hiding my identity there. When COVID hits, in spite of risk and uncertainty, I joined back again in the ICU. I wanted to be the front line in the crisis. And why I did all these things? All these things are just to push my boundary that I was so used to by that time. In this high pressure environment, I do balance, although very limited tools were available at that time. I do manage my calorie, I do manage my mobility, I do manage my insulin timing. I never forgot my insulin in my 2.5 decade journey. I never give excuse of my insulin deficiency in entire my working life. I wanted to do everything a normal person can do and did not my condition deter me. When sometimes working in ICU, there was a time when we have to skip my lunch, but I do consume that 25 dextrose, 50 dextrose or 5D bottle, saline bottle, easily available in ICU or OT. I do consume and maintain my potential hypoglycemic situations. And slowly I was transforming in a way that all these limitations were faded from my way. With this focus, I completed multiple roles while working in pharma sector, including the last one while I was working as a country immuno-oncology lead while working in Roche. The frequent travel, I had to travel frequently in my 6 years long pharma working life, where when hopping through the multiple airport, I do grab some sugar pouches available in the food counter just before boarding. Although I was carrying my diabetic kit along with me, but that was my more normal way to prevent potential hypoglycemic episode. And despite all the doubt, I do marry my 10-year-long girlfriend Rubina, who was also a part of that support system, what I built in my graduation days. With the help of that baby, I produced 2 more babies. So now I have 3 babies. Why I call them babies? All these 3 depend on me. Mostly emotionally, not financially, because she is also a software developer. But how it is. And she's also never give me a tag of any limitation. She never, on the dining table, never called me to take insulin or never restrict me to have any food till date. So, finally, this is the time when I proved wrong to those people who ask questions about my basic instinct. We have 2 basic instincts, right? I proved them wrong by that time. Over the years, I achieved all those materialistic KPI, key performance indicator, that society wants to be successful, right? This one society, I had to hide my type 1 episode to my in-laws at that time. Because if they know, they cannot allow me to marry with her. Because they have a question whether I can fulfill this materialistic KPI or not. By that time, I fulfill. I'm not even 40 now. But when it is done, I wanted to do more. But this time my society is not going to decide the limitation about me. Now, it was Mahatma Gandhi. We are at the land of Mahatma Gandhi. Once he told, be the change you wish to see in the world. Now, embracing the role of entrepreneurship by building Rehai was my way of embracing those changes. When Indian economy is booming, I also want to contribute to the growth of the Indian economy in a healthcare ecosystem where we can serve patients little better. This is the time when I learned my second principle of thriving in life, responsibility. Whatever the situation you are going through today, you have to take responsibility of your own. Instead of the blaming fate, fortune, or the people surround you, start explore your potential to achieve, to overcome or manage those situations. Excuses are many, but we need only one reason to achieve our potential. By creating a support system, taking responsibility of our own, we start working on our mindset, which was solution oriented. Rehai was the outcome of that solution oriented mindset. Over the past 14 years, I have seen healthcare from the different side of the table, sometime in a pharma, in a clinic, or in an administrator. I understand that there was a need. To streamline the unorganized in-hospital experience for small and medium segment hospitals. And that's why I shifted to my hometown and started building a hospital as a pilot project of Rehai, just to understand the ground reality, understand the ground challenges. Whether it was multiple attempts to crack the exam or to find an investor to build these hospitals or to make a decision to resolve the challenges of healthcare ecosystem. The only thing that keeps me sustained is the third and final principle of thriving in life, resilience. Resilience is the ability to recover from the difficulty. Every hypoglycemic situation, every missed flight, every failed CPR, every corporate grill trained me to adapt those situations without panic. Thriving in a high pressure environment was not about my condition. It was about the choices that I made. And what gave me strength to fly at 40,000 feet is nothing, just these 3 simple principles. Just reach out for support, take responsibility of your own, and be resilient. The truth is, we all, whatever type on or whatever, we all have to face challenges at certain point of time. In spite of those challenges, put a limitation in our growth, we have to be those three. Reach out, find our own people, we have to take our own responsibility and staying resilient. If I had given to all my conditions, I would probably not be here sharing my story after injecting over 25 years. Even for my future turbulence, that will be even more. These three will be my single guiding force. And I am sure we can overcome on our challenges by adopting a mindset that break those limitations and help us to thrive in life. So that's all till now. And
Thank you, Dr. Tahir. Thank you so much. This was really inspiring, and we should learn a lot from Dr. Tahir, inspiring story, and whatever he has suggested, I am personally going to execute in my life, and let's see how it works. I'll share my reviews as well with
yeah,
you. Thank you so much.
Thank you.
So, as Dr. Tahir mentioned, connection is very important. Being a T1D, we have to try to connect with other T1Ds as well. But sometimes because of unawareness or shyness, or sometimes because of the society, we don't try to connect with other T1Ds, and which causes loneliness. On this topic, I would like to invite Miss Sanskriti Kotle. She's from Pune and T1D also, and she helps community through Blue Circle Diabetes Foundation. Welcome, Miss Sanskriti Kotle.
Hi everyone, good morning. Today I'm going to be speaking about disconnected people living with diabetes. It's time to reconnect. Hi, my name is Sanskriti Kolte and I've been living with type 1 diabetes for now 12 years. I'm a patient advocate for type 1 diabetes. I volunteer with Blue Circle Diabetes Foundation. I host their events, I carry out workshops, we go to schools for awareness sessions, and at last professionally I'm a graphic designer. So, living with diabetes is not only about eating well, maintaining a healthy lifestyle, or taking right doses of insulin. Diabetes is ever changing. It's a lifelong learning process. My symptoms of hypoglycemia have changed over the years. But how do we keep learning? How do we adapt every day? I was 12 and a half years old when I was first diagnosed. I was the only one in my hospital with type 1 diabetes, and my parents and I believed that we were all alone. For 2 years, I struggled in isolation, trying to navigate a new normal that no one around me truly understood. I was getting used to taking injections every day, yet alone taking injections before every meal. For that 12-year-old girl who didn't know what injections were, because that is not normal. We only take injections for a vaccine or something. But this was my new normal. I was going to take injections before every meal. That was around 4 times a day and plus every correction doses. I had my friends to support me. I had my families to understand that taking injections is not easy. But still, there was no one to understand that taking injections is still a very, very difficult thing for a newly diagnosed person. One day when my mixed start was giving me late night hypos and my routine was disrupted due to changing of schools and many other different things, I stumbled upon Blue Circle Diabetes Foundation, and that changed my whole life. Finding community through Blue Circle and attending my first ever meet was like finding a home. There's no better feeling than sitting in a room where people just get you, where no questions were asked that why suddenly you were craving sweets after a hypo, or why your mood swings when your sugars are high. The smallest things, like having someone laugh about carrying snacks everywhere, made me feel seen. Haven't you all been through that? Like at least people living with diabetes, when you relate to someone that, oh, do you have a glucose tablet? I just had this with Rohan. I was going in hypo and I asked, oh, mujhe glucose tablet chahiye. And people had that and that made me feel so relatable. Blue Circle Diabetes Foundation isn't just a support group. It has become my extended family over the years. It has helped countless people with diabetes connect, share experiences, and break the stigma surrounding diabetes. Our work includes awareness campaigns, workshops, meetups, and online support spaces where people living with diabetes can ask questions, seek advice, and truly just vent about diabetes, okay, because it's not an easy thing. More than anything, it fosters a sense of belonging, a feeling that no one should have to fight this battle alone. Why, even though there have been so many inventions in diabetes sector, a lot of us are still living in isolation. And why do you think is that? It is majorly because of lack of awareness and representation. Peer support and emotional well-being are often overlooked in diabetes care. We often overlooked our mental well-being. We only think about, okay, we have taken our daily doses, correction doses, etc. Diabetes burnout. The constant monitoring and decision making lead to exhaustion, making many disengage from seeking help beyond clinical visits. I used to go to my clinical visits every second Saturday, and my doctors used to tell me, okay, you ate breakfast a little too much carbs, and that's why you could not maintain your, sugar levels throughout the day. You should have taken less carbs in dinner. That's why you had that 4 a.m. Hyperglycemia. Social stigma and misconceptions. People hesitate to share their diagnosis out of fear of judgment and discrimination. We heard Dr. Tahir said that he did not tell anyone that he had type 1 diabetes throughout his major journey. And same goes for me. I could not tell anyone that I had type 1 diabetes because I had to take injections. And that was not easier for me because I was 12 years old, changing schools, going to different places, and then I had to take injection. And it was very, very out of place. I did not feel the belonging over there. Yes, my friends were there with me, and every time I took out my injections, everyone was like, okay, please go to the washroom, don't take it in front of us. Like, yes, that is something that we all face, judgment or discrimination. How do we reconnect ourselves? A disconnected person living with diabetes is more likely to experience distress, neglect self care, and develop complications. A real question is how or why do we reconnect them? I did not know about a community existed for of my diagnosis. I found out that there are more of us living with diabetes when I was 4 years into diagnosis. Why do we need to reconnect? Better mental and emotional health. Support groups reduce diabetes distress, anxiety, and depression. When you have someone to talk about diabetes or just the thing that, okay, I had my hypers today in the morning, and you don't need any advice. You just need someone to listen and that feeling of relatability. Improve diabetes management. Learning from peers and real life experiences enhance self care practices. Greater awareness and advocacy. A united diabetes community leads to better policies and representation. Motivation and empowerment. Seeing others thrive despite diabetes fosters confidence in self-care management. When I see people living with diabetes thrive, go to so many different places, travel, excel in their professional careers, it gives me the confidence that one day I can do that too. And there's nothing stopping me. How can we help to reconnect? If you know someone who seems withdrawn or struggling, here's how to help them reconnect. Introduce them to support groups. Recommend organizations, diabetes foundations where they can find peer support. Talk about emotional sides of diabetes. Acknowledging diabetes distress can make a world of difference. When someone tells you that they're going through the same thing, makes you feel that you're not alone again. There is someone with you and you're not facing the thing all by yourself. Encourage community engagement. Suggest meetups, workshops, or local diabetes events where they can interact with others. Guide them to safe digital spaces. Online communities and social media can be valuable tools for connection and learning. After COVID, I feel online digital spaces have been so important because all we have during COVID was online workshops and seeing everyone through that one screen of your computer. Promote awareness and representation. Sharing personal stories can inspire others to come forward and seek support. Here I'm going to go a little out of line and tell that once I shared my story on my Instagram, and there was a little girl whose father contacted me, and they were like, oh my god, I am from a very very small village and there's no doctor who knows about type 1 diabetes, but I somehow stumbled upon your account and I saw that you're traveling, you're doing this, you're doing that, and I feel so proud that my daughter is not alone and one day she can do the same things. And that was the win for me. I felt that my story that when I shared my story online and with everyone else, I felt that I have done something correct. I felt that okay, this girl is not going to be alone. She will have someone around her to feel connected. Importance of community. We often talk about diabetes in numbers, blood sugars, carb counts, insulin doses. But what we don't talk about enough is how diabetes makes us feel. The exhaustion, the mental load, the burnout. I have been here for 2 days, and the day when I landed, I had a severe hyperglycemia, and I was alone on the airport. And then I realized, oh my God, I'm going through this hyperglycemia. What do? I don't have my glucose tablets, but somehow I managed myself. It gave me a real bad burnout, but then I remembered, okay, I can do this. I'm not alone, and I have a whole community. To conclude, I would like to say diabetes is more than just numbers. It's a daily challenge that requires resilience and support. No one should feel alone in this journey. As healthcare providers, educators, and individuals, our role extends beyond prescriptions. We have the power to foster connections, inspire confidence, and change life. At end, I would like to end with a quote by Nupur Lalwani, the founder of Blue Circle Diabetes Foundation. Together, we have over 100 years of shared experience. Let us use that to enhance our lives. Thank you.
Thank you so much, Sanskriti. I'm so glad to know that our next generation is so much more aware, so much more educated, and I think completely self-reliant to manage their type 1 diabetes. Thanks to all the support groups and thanks to such souls for inspiring us, because I too have such a soul at home, my daughter. So she's also been living since 15 years, and yes, she's very positive about it. Thank you so much, Sanskriti. Now I would like, yes, ma'am.
It's a great example how change surrounding, because we sometimes, as you say, discrimination and we feeling not comfortable say about. I, to be honest, I long time make secret from this because nobody married me. But it's not true. But it's we make ourselves make secret. And if we are honest, as you make great example, and it doesn't matter, it's people only follow you. It doesn't matter this is your disease. It's a great, great example. I'm very happy that you are strong and make this like picture.
Thank you so much, ma'am. So I also would like to quote one thing said to me by Nupur. She once told me कि भगवान अगले जन्म में डायबिटीज देना है तो दे देना, पर एक टाइप 1 डायबिटीज बच्चे की मां मत बनाना. So I completely relate to it that the journey is definitely challenging. Now I would request Mr. Sumit Dhingra to please join us. He's part of the diabetes community and living with type 1 diabetes from the past 34 years.
Good morning, everyone. जैसे मेरे कलीग ने मेरे फेलो टी1डी से बताया, इसी तरह मेरी जर्नी भी सिमिलर उन लोग के जैसे ही है. Sorry, I will continue with Hindi. So in 1999, जब मैं 6 साल का था तब मुझे डायग्नोस हुआ था. So at that time it was earlier initially misdiagnosed. मुझे वॉमिटिंग सेंसेशन हो रहे थे, कंटिन्यूस सांस फूल रही थी और इमरजेंसी में एडमिट किया. तो डॉक्टर ने इमीडिएटली इंजेक्शन दिया तो वॉमिटिंग बंद हो गई, बट कंटिन्यूस सांस फूल रही थी और लिटरली मैं ऑलमोस्ट कोमा में ही था. बट एट दैट टाइम जो ऑलमोस्ट दिवाली का टाइम था तो सीनियर डॉक्टर वाज ऑन लीव. सो स्टूडेंट डॉक्टर जो थे उन्होंने एज अ ट्रीटमेंट ग्लूकोज के पाइन दिए और ओरली भी मुझे ग्लूकोज दिया गया था. सो इनिशियल 2-3 दिन में तो कुछ मालूम नहीं पाया. फिर जब सीनियर डॉक्टर आए तो उस टाइम पे उन्होंने चेक किया तो उनको सिम्टम्स लगे कि डायबिटीज हो सकता है, तो उन्होंने इमीडिएटली बोल दिया कि आप शुगर चेक करवाइए. सो आफ्टर 3 days ऑफ मिस डायग्नोस्ड शुगर चेक किया तो इट वाज 425 एंड डॉक्टर सेड कि इसको टाइप 1 डायबिटीज है, सो इसको इंसुलिन कंपल्सरी लेना पड़ेगा. सो फ्रॉम दैट डे टू टिल नाउ डायबिटीज के आई वुड से डायबिटीज के वर्ल्ड में जो भी कुछ डिस्कशन हो रहा है, जो भी कुछ है, मैं सब कुछ मैंने एक्सपीरियंस में कर चुका हूँ. बट देयर इज अ कोट फॉर महाभारत कि महाभारत में जो भी है वो सब कुछ हम आज देख सकते हैं. आज जो कुछ नहीं है वो महाभारत में नहीं था. सिमिलरली डायबिटीज वर्ल्ड के अंदर जो भी कुछ एस्पेक्ट के हिसाब से हम डिस्कशन कर रहे हैं, जो भी कॉम्पिटिशन डिस्कशन हो रहा है, मैं सब कुछ एक्सपीरियंस कर चुका हूँ. जो मैंने एक्सपीरियंस नहीं किया है डायबिटीज के बारे में कुछ डिस्कशन नहीं हो रहा है. लेट मी शेयर विथ माय लाइव एग्जांपल. सो इनिशियल मैंने बोला मिस डायग्नोस, उसके बाद बेनेडिक्ट लिक्विड सॉल्यूशन से जो शुगर चेक करते थे यूरिन से, उसके बाद ग्लूकोमीटर और उसके बाद सीजीएम, वो सब कुछ मैं ट्राई कर चुका हूँ. सिमिलरली इंजेक्शन लेने के लिए ग्लास सिरिंजेस के यूज हो रहा, उसके बाद डिस्पोजेबल नीडल आई, उसके बाद बीडी की नीडल जो हम यूज करते थे, उसके बाद पंप, वो भी एक्सपीरियंस करता हूँ. राइट नाउ आई एम ऑन डीआईवाई लूपिंग, सो वो भी अलग एक्सपीरियंस है. इनिशियल डेज में जैसे हर एक बच्चों को होता है, हर एक पेरेंट्स को भी होता है कि मेरे बच्चे को डायबिटीज हुआ है तो उसको क्या कर सको कि डायबिटीज चला जाए. सो सिमिलरली लाइक ऑल पेरेंट्स, मेरे पेरेंट्स ने भी बहुत ट्राई किया, सभी बाबा आयुर्वेदाचार्य सभी जगह पे गए. तो इनिशियल डेज में मैंने 3 से 4 बार इंसुलिन बंद कर चुका हूं मैं. एट दैट टाइम इनिशियल 3-4 दिन होता है, उसके बाद में फिर कोमा में. सो सीवियर डीके है. मेरे डायग्नोस के इनिशियल 10 साल के अंदर मैं कम से कम 10 से 12 बार मुझे हॉस्पिटलाइज करना पड़ा था. I was in severe decay 3 to 4 times and severe coma 2 to 3 times. So ये इनिशियल स्टेज की बात थी. उसके बाद 98 के बाद थोड़ा स्टेबल हो गया था. I started by managing my diabetes by myself. थोड़ा थोड़ा समझना शुरू हुआ था, स्टेबल हो गया था. बट बीच में देयर वाज अ फेज व्हेन आई वाज इन टीनेजर. सभी टीनेजर को ये फेज आता ही है ऑलमोस्ट. एट दैट टाइम मैंने इतना सारा कुछ ध्यान नहीं रखा था. मीन्स ये ऐसा कि डायबिटीज है तो शुगर बढ़ेगा तो डॉक्टर इंसुलिन बढ़ा देंगे और कम होगा तो इंसुलिन का डोज कम कर देंगे. तो ड्यू टू सच काइंड ऑफ मिसअंडरस्टैंडिंग मैं बीच में 15 से 20 साल डॉक्टर को दिखाने के नहीं गया था. सो एट दैट टाइम 2002-3 के आसपास में बात करूं तो एट दैट टाइम देयर वाज नो अवेलेबिलिटी ऑफ ग्लूकोमीटर इन इंडिया. मेरे फ्रेंड सर्कल में रिलेटिव्स में यूके से और यूएसए में ग्लूकोमीटर की स्ट्रिप्स और ग्लूकोमीटर वहां से भेजते थे. बट समहाउ मुझे दिमाग में क्या था तो मैं ग्लूकोमीटर यूज नहीं करता था. इवन स्ट्रिप्स भी एक्सपायर हो जाती थी, 6-6 महीने 1-1 साल 2-2 साल तक स्ट्रिप एक्सपायर होती थी, मैं यूज नहीं करता था. तो एक ऐसा फेज भी लाइफ में था. फिर उसके बाद जब कैरियर की बात हुई तो आई वाज डूइंग माय जॉब ऐसे नॉर्मल इंसान से भी ज़्यादा प्रॉपर तरीके से मैं काम करता था, फिर भी मुझे जॉब में सुनना पड़ा था। जो नॉर्मल नॉन डायबिटिक लोग थे वो लोग प्रॉपर तरीके से 8 घंटे की ड्यूटी नहीं कर रहे थे, मैं 12-14 घंटा भी काम करता था इवन आफ्टर हैविंग डायबिटीज एंड टेकिंग इंसुलिन्स, फिर भी मुझे ये सुनना पड़ता था। तो जॉब में भी वर्क प्लेस में भी कहीं पे ताना सुनना पड़ा, ये सब स्टिग्मा हमारे सोसाइटी में है, तो वो भी एक्सपीरियंस बहुत बुरा रहा है मेरे लिए। फिर उसके बाद मैरिज की बात आई तो अगेन द मैरिज एंड टी1डी का जो स्टिग्मा सोसाइटी में है वो भी मैं फेस कर चुका हूँ। इनिशियल डेज में सब लोग मना कर रहे थे। आई गोट रिजेक्टेड बाय वन ऑफ by sorry, I am confessing myself, by parents of my girlfriend. So due to diabetes, nothing else. और उसके बाद थोड़ा जैसे सबको जो यंगस्टर है, जिस जो मैरिज के एज में है, उन सबको जो स्ट्रेस रहता था वो स्ट्रेस मुझे उस टाइम पे रहा था 3-4 साल तक। आफ्टर ऑल विथ ग्रेस ऑफ गॉड I got married to my wonderful wife वैदेही, और उसका सपोर्ट बहुत अच्छा अभी तक मुझे मिल रहा है। आफ्टर डूइंग ऑल दिस थिंग्स, फिर ये सब चीज़ें चलती रहती थी लाइफ में, और फिर तो मैं धीरे धीरे शुगर लेवल अच्छा कंट्रोल में करना शुरू भी कर दिया था। बट हैविंग लॉन्ग टर्म ऑफ अनकंट्रोल्ड डायबिटीज आफ्टर डायग्नोस 27 years of डायग्नोस, वन बाय वन कॉम्प्लिकेशंस आना शुरू हो गए। इनिशियली रेटिनोपैथी, उसके बाद में नेफ्रोपैथी एंड देन न्यूरोपैथी। सो मेरी लाइफ में छोटी मोटी 12 से 13 सर्जरी हो चुकी है। मेजर सर्जरी किडनी ट्रांसप्लांट हो चुका है ड्यू टू डायबिटिक नेफ्रोपैथी। देयर इज नो विजन इन माय लेफ्ट आई ड्यू टू रेटिनोपैथी, एंड डायबिटिक फूड भी है। ये सब चीज़ें जो मैं आपको बोल रहा हूँ कि ये सब चीज़ें क्यों हुई, कि ड्यू टू लैक ऑफ एजुकेशन अवेयरनेस। जब 1990 में मुझे डायग्नोस हुआ था, उस टाइम पे ऐसा कुछ अवेयरनेस एजुकेशन नहीं था, और जस्ट खाली इतना ही मालूम था हमें कि डायबिटीज है तो इंसुलिन लगाना है, और ये मीठा नहीं खाना है, तली हुई चीज़ें नहीं खानी है, थोड़ी एक्सरसाइज करनी है, दैट्स ऑल। उसके अलावा कुछ डायबिटीज का नॉलेज किसी को नहीं था, घर में भी नहीं था, फैमिली में नहीं था, और इसके ज़्यादा कुछ किसी का ऐसा कुछ था भी नहीं कि बस ये इससे लाइफ चला नहीं है, उसको ज़्यादा कुछ करना नहीं है। मैं कंटिन्यूसली ये पीयर सपोर्ट के इस में ढूंढ रहा था कि मुझे कोई ना कोई पीयर सपोर्ट ग्रुप मुझे मिले, बट मुझे 29 साल की लाइफ में कहीं भी कोई मिला नहीं था। इवन दो अभी मैं जैसे सबको मालूम क्या है, आई एम कनेक्टेड विथ द डायबिटीज फाउंडेशन। जाज मेरे घर से हार्डली 2 किलोमीटर दूर रहती है, फिर भी हम एक दूसरे को जानते नहीं थे। सो थैंक्स टू द पीयर सपोर्ट ग्रुप के उनसे हिसाब से ये सब चीज़ें अभी मैं कनेक्टेड हूँ, और एजुकेशन लेने के बाद अभी जो क्या बदलाव आया है, उसके पहले मैं आपको एक स्टोरी सुनाना चाहता हूँ। सो एज अ T1D हमें ये स्टोरी किसके बारे में बताऊँ आपको? एज अ T1D हमें हमारा खुद का नॉलेज गेन करना पड़ेगा। तो नहीं करेंगे तो हमारे लिए ये हमारे लिए करना है, दूसरे के लिए नहीं करना है। सो लेट्स बिगिन विद स्टोरी। सो एक गांव में एक परिवार में एक बुजुर्ग रहते थे। वो बुजुर्ग सबके चाहते थे, मानीते थे, घर में सबके चाहते थे, छोटे बच्चे से लेकर उसके सन वाइफ सबके मानीते थे, चाहते थे। बट वन ऑल ऑफ सडन उनको कुछ बीमारी आ गई तो हॉस्पिटलाइज करना पड़ा। आफ्टर गेटिंग डिस्चार्ज फ्रॉम हॉस्पिटल, फिर डॉक्टर ने उन्होंने बोला था कि बहुत वीकनेस आ गई है, आपको जो बुजुर्ग है उनको अच्छी तरह से खिलाना पड़ेगा। बट समहाउ उनके दिमाग में क्या आ गया था, तो वो लोग घर के सभी सदस्य उनको खिला रहे थे, फिर भी जो बुजुर्ग है वो मना करता, मुझे नहीं खाना है। तो उनको 1 दिन हुआ, 2 दिन हुआ, 3 दिन हुआ, कुछ खाने के लिए मना कर रहे थे। फिर वन बाय वन सब पूछ रहे थे, बाबूजी आपको क्या चाहिए, आपको कुछ खाना है? तो ही वो सेइंग राम जी नथिंग एल्स। सो अगेन उनके बड़े बेटे ने समझाया कि आपको कुछ खाना है, कुछ स्पेशल आपको जो आइटम पसंद है वो हम खिलाते हैं आपको, मिस गुजराती में शीरा बोलते हैं, तो आपको शीरा खाना है। तो ही वॉज सेइंग राम जी कुछ भी आप बोलो तो खाने के लिए कुछ बोलते भी नहीं थे, कुछ रिएक्शन नहीं, ओनली इज कंटिन्यूस अटरिंग राम जी नथिंग एल्स। फिर फैमिली वाला डॉक्टर से कंसर्न किया तो आपको कुछ खिलाना पड़ेगा, अगर वो खाएंगे नहीं तो उसकी रिकवरी जल्दी नहीं आएगी। तो उस टाइम पे जब फैमिली वाले वन बाय वन बोलते थे कि आपको कुछ खाना है तो मना करे राम जी ऐसे ही बोलते रहते थे कंटिन्यूस। फिर उसके बाद फोर्सफुली सब खिलाना शुरू कर दिया। तो आप बापू जी आप मुंह खोलो, हम आपके मुंह में निवाला डालते हैं। तो ही वो सेइंग राम जी। तो फोर्सफुली मुंह खोल के उनको निवाला डाला। तो फिर भी वो लोग ऐसा बोलते हैं, वो बापू जी ऐसा बोलते हैं कि राम जी मुझे खाना नहीं, ऐसा कुछ बोलते नहीं, लेकिन वो ही वॉज कंटिन्यूसली अटरिंग राम जी। तो कहने का मतलब क्या है कि आपके पास सब कुछ अवेलेबल है, सब सेवा करने के लिए रेडी है, फिर भी आपको खाना नहीं है तो आप आपकी हेल्थ नहीं अच्छी रहेगी। सिमिलरली अभी एज अ T1D हमारे पास सब कुछ है, एज ऑफ नाउ एडवांस टेक्नोलॉजी अवेलेबल है हमारे पास, अच्छे अच्छे डॉक्टर है, एजुकेटर्स है, पीयर सपोर्ट ग्रुप है, बट अनलेस एंड अनटिल हम लोग इसका यूटिलाइज नहीं करेंगे, हम उसका यूज नहीं करेंगे तो हमारे लिए काम का नहीं है। एज अ टाइप 1 डायबिटिक हमें खुद को हमारा डॉक्टर होना जरूरी है कि डॉक्टर की एक लिमिटेशन है कि पूरा दिन हमारे साथ में नहीं रहने वाले हैं, डायबिटीज लाइफ लॉन्ग कंडीशन है। सो ऐसा नहीं कि वो एक बार हो गया तो 4-5 महीने में चला जाने वाला है। तो हमें खुद को देखना पड़ेगा कि हमें हमारी पैटर्न जाननी पड़ेगी कि ये खाने से मेरा शुगर लेवल कैसा रहता है, ये खाने से शुगर लेवल मेंटेन रहता है कि नहीं, ये चीज मेरी शुगर लेवल बढ़ाती है, ये शुगर लेवल कंट्रोल करती है। जो कंट्रोल करती है वो कंटिन्यूएशन में रखना है, और जो बढ़ाती है वो लिमिटेशन करना है। सब कुछ चीजें हमें जानना जरूरी है। तो ये अनलेस एंड अनटिल ये जो भी रिसोर्सेज हमारे अवेलेबल है उसको यूटिलाइज नहीं करेंगे, वो हमें सामने से खुद से करना जरूरी है। ये नहीं करेंगे तो हमारे काम का नहीं है। लास्ट में एक लास्ट सेंटेंस बोल के अब ये मेरे टॉक खत्म करता हूँ कि जो भी कुछ आपके पास रिसोर्सेज अवेलेबल है, एजुकेशन से, डॉक्टर से, टेक्नोलॉजी है, उसका यूज करो और अच्छे से अच्छा आपका शुगर कंट्रोल में रखो। शुगर कंट्रोल में होगा तो आपको लाइफ लॉन्ग कुछ भी प्रॉब्लम होने वाले नहीं है। बट जो कंट्रोल नहीं होगा तो यू हैव लाइव एग्जांपल इन फ्रंट ऑफ यू। आज से 5 साल पहले का सुमित भी आपको मालूम है और अभी का सुमित काफी सारे को मालूम है कि अभी मेरा शुगर कितना कंट्रोल रहता है। सो बोथ आस्पेक्ट यू कैन सी। ऑल द बेस्ट।
थैंक यू मिस्टर सुमित, इट वाज रियली इंस्पायरिंग। और आपकी जैसी जर्नी से मैं काफी रिलेट कर सकता हूँ। एंड सो थैंक यू सो मच फॉर शेयरिंग योर वैल्यूएबल पॉइंट्स एंड योर जर्नी। एंड मूविंग फॉरवर्ड, whenever we talk about type 1 diabetes and our community, someone who really inspires is T1D doctor. He's or she is T1D and he's doctor as well. So it is really inspiring when for me, are you T1D and are you doctor as well? Oh my God, this is how we react personally. So now I would like to invite Dr. Anushri. She's a T1D since like last 25 years, and she's an endocrinologist. She has MBBS and a fellowship in diabetes, and also she's associated with Juvenile Diabetes Foundation, I think the longest running foundation related to diabetes in Mumbai. Dr. Anushri, over to you.
Thank you. So, I'm really, really humbled today being on this stage after listening to everyone's story. So, I'm very thankful for the opportunity. So, we're going to talk today about diabetes burnout. Have any of you experienced diabetes burnout? Yes, all hands are up. Yes, I think all of us have, right? So what is it like to live with type 1 diabetes? I'm not going to spend too much time on it because you guys have given elaborate representation of what it's like to live with type 1 diabetes. But type 1 diabetes is a 24/7 job that none of us signed up for. It was just assigned to us
We don't get any holidays. We don't get any bonus. We don't get any promotions. We occasionally get discounted supplies, right? And we don't have the option of failure. And even if we do fail, we have to rise up like how Sumit did. Recently, I had gone on a vacation with a friend of mine, and we were going to go to the pool. And I started doing everything. I detached the pump, I checked the sugar. I said, oh, should I take some food? And my friend just casually remarked that, this is like a disability, right? I said, yeah, it is. And nobody can see it. And a lot of us are now talking about it. I've seen some social media reels about how type 1 diabetes actually is an invisible disability. Nobody can see what your disability is. And it's very hard to imagine unless you're living with it or you're living with someone who's close to, So what does living with type 1 diabetes involve? Let's see what the day would look like. You count your carbs, you balance your food, you check your sugars, you take injections, you calculate meal boluses, you calculate corrections, you check sugar again, you prevent low blood sugar, prevent high blood sugar, you exercise, you take insulin, you do side rotation, check if your TIR is right, you check if your blood sugar pattern is right, you try to adjust your doses to get the right pattern. And this is just diabetes. You still have to do the other things that everybody else does. And I think this has already been elaborated. So it is natural to face burnout because even without diabetes, people face burnout. It's a very big thing nowadays. So diabetes is actually, the burnout is actually a spectrum. So it's burnout, distress, diabetes related depression. It is a spectrum of the mental health suffering that a person with type 1 diabetes goes through. Burnout does not necessarily mean that a person is in depression or that person has very high levels of diabetes distress. It definitely increases your risk of, going towards depression or distress. So burnout very simply is a state of emotional and physical exhaustion. It occurs when you're overwhelmed with managing your diabetes, and it generally leads to neglecting diabetes care and ultimately may lead to increased risk of complications. I think Savita ma'am said it, that it is worse for the parents because all fingers are pointing at them. It's tough. It's easier to be a person with type 1 diabetes than to be a caregiver. You have too much pressure on you, mentally also. So burnout is also very common in caregivers and it is very poorly recognized. They don't have anyone to talk to. They can't go and tell their friend that I'm fed up of treating my daughter. They can't say that. So it's probably more difficult for them, and we should all be grateful to our caregivers, and occasionally appreciate them. You feel distressed, you feel frustrated, anxious, you may even feel a little depression. So there were some descriptions of how patients have described burnout. So there was someone who said that I have tried to sort it out, but I just can't. I eat what I want when I want, I inject when I want, I get scared about it, but then I end up being worse. And I'm still young and I'm just fed up. Okay, there's another description which says that you start to feel that you're constantly fighting a battle with your own body, and it's as if your body will do anything to make your life a misery. It does help to talk to someone, and it's good to know that you're not alone in this. So it's a very vague terminology. We are still describing it when I looked through the literature. So these were a few answers that I found. So how do you feel if you feel burnt out? You might feel frustrated and angry. You just want to get rid of the diabetes. You feel disillusioned, like you can't win. Diabetes is controlling my life. You worry about the diabetes, but you don't seem to do anything about it. You don't know where to start or what to think. You feel alone with your diabetes, and you do things like skipping injections or, not checking your sugars, which are not right, but you'll still do it. I mean, we've all done things which are not right, and we still do it knowing them, like breaking the signal, very common. So how would one recognize diabetes burnout? Now, we do get fleeting moments of burnout, which I think we manage to handle on our own. But when it becomes a prolonged thing, that is when it needs to be addressed. And care, as far as type 1 diabetes is concerned in India, is improving day in and day out. And we are going to be seeing a lot of patients with burnout. You all as advocates, me as a doctor. So it's going to be important to recognize the condition. So we start with creating awareness, which is why I'm very glad that we have this session today. So a person may feel will have very negative feelings about their diabetes, like frustration, anger, you feel like diabetes has taken over your life. You feel powerless, like I'm just not able to do anything. You feel isolated or alone. And then what you do is you completely ignore everything. You don't check, you inject because you're supposed to live. Otherwise, you'll land up in the hospital. And then you just behave like you don't have diabetes. Okay? So you don't check sugars, and as we all said. And one thing is that you detach. You detach yourself from your family. Sometimes you detach from the people who are going to help you, because you don't probably are not ready to come out of it, or you're still coming to terms with it. So detachment can be a little dangerous. And if you do get detached occasionally, it's very important to reconnect. So there are very specific triggers for burnout, and all of you have mentioned it. Rejection by society, stigmatization by people. But what I've seen very commonly is that when some other part of your life goes wrong, so if you're passed up for a promotion, or you didn't get the appraisal you want, or you get rejected by a girlfriend or boyfriend or their parents, or you undergo some major life transitions, like you shift from school to hostel, you shift from student life to professional life. So these are the periods when you are at very high risk of developing distress because your mind is affected. And I always believe that even though diabetes is all about sugar, the management is all about your mind. We always talk about how you should gain knowledge. Tahir didn't talk about pump or CGMS. He talked about resilience. He talked about responsibility. So type 1 diabetes is about the mind. And your mental health is probably the most important if you want to live happily, healthily, and thrive with type 1 diabetes. And mental health in India is the most neglected healthcare aspect. And that is why we are not seeing, we are seeing it now, but that is why we faced years of people who are struggling with type 1 diabetes, because they were not given good mental health care. So when we talk about prevention or we talk about treatment, I think the answer is simple. Community support, talk, create awareness. If somebody is feeling a burnout, they have to know that it is okay to feel like that. You are not a failure just because you don't want to care for your diabetes. It is absolutely fine. And it is okay. We always talk about positivity, but sometimes I think it is okay to be negative. It is okay to have negative feelings for your diabetes. It's okay to not want to take your sugar. It's okay to want to have a French fry or a cheesecake. It's very famous in Ahmedabad, I've heard. So it's okay to, indulge. It's okay to not want to meet your type 1 friends because they are advising you on how to live your life. That's fine. And that is what should be conveyed to everyone. You are feeling a burnout, you come, you talk to us, we will not judge you. And maybe that will just cure the condition. That's it. So seeking help, seeking support group, having a diabuddy who you can crib to, vent out to is very important. And these are pictures of my diabuddies. So we have our annual camps, which are a stress buster, and probably the biggest mental health care that all of us get in 1 year is our annual GDF camps, which are residential camps. Then we used to organize type 1 runs, which have now become a big WhatsApp group of people participating in different marathons everywhere. And this is the photo of our trek, which is it's a fun picture of everyone mimicking a meme. So I think it's very important to have friends with type 1 diabetes. And it is more important to know that that friend with type 1 diabetes also does cheating the way you do. So I think, so there are a lot of memes going around on social media which says that couples who do unhealthy activities together feel closer than couples who do healthy activities together. So I think probably somewhere it applies to friends also, you know. So very simple tips is something that I tell a lot of my patients, and something that I follow is that when you work in a corporate, I'm sure all of you all have some exposure. They have SOPs, they have operations manager. So what they want is they want daily things to become a routine so that you don't have to think about it. So I always tell that your type 1 diabetes related tasks should become a routine. It should become a way of life that you don't think about. So you wake up in your morning, you check your sugar, you brush your teeth, you make your coffee, you take your insulin, you have your breakfast, go for a bath, you know, then you go to work or clinic or whatever. It's lunchtime, you check your sugar, you take your insulin, you have lunch. So you don't have to think about it. It becomes a routine for you. It's something that you're doing day in and day out. The way you eat, the way you bathe, the way you brush your teeth, that is how your type 1 tasks should be. And if it becomes a part of your life, then you'll always be in harmony. It's not that you're not going to face challenges. It's not that you're not going to face distress or burnout, but it'll make your life maybe a 30% or a 40% easier. Because if every time you're going to think about it, so I don't know if people who have kids will know na, how your child keeps thinking about things and you keep telling them, do it, do it, do it. And they just say, I'll do it later, I'll do it later. So if you think about it, it becomes a task. But if you just do it, it's just done. It's not a task anymore. So it's a way of life. And very important is that if you want help, please ask for help. It's very, very important. And you're not a failure if you ask for help. You are not, there's no stigma associated with it. There is no judgment. If you want help, there are so many people here I can see who are ready to help. Please ask for help. Thank you.
Thank you, Dr. Anushree. So the takeaway lesson is, let's all find our partners in crime with whom we can cheat. And also learn that it's always a partnership, a balance between the mental health and the physical health. Thank you, Dr. Anushree. Now I would like to welcome Vaishali Vakil and Paras Devani, again from the Mumbai JDF team, to please guide us how they are a part of the team and how they are helping and supporting so many kids, being the oldest community.
Thank you, dear Savita, for the lovely introduction. Mostly the things we wanted to speak is already covered here. Anushri has told a lot. Sumit has spoken about these things a lot. So let me introduce myself properly. I am diagnosed in 1988, 37 years back in a small town. Okay. So I have used those glass syringes. I have used Benedict solution. Okay. And whatever information was given by the doctor was hardly the dosage and all. So our topic today is doctor and caregiver harmonious relations. Okay. So how a harmonious relationship between the doctor and the caregiver, maybe a primary caregiver like the mother of the child, or we are taking care of ourselves, or for example me myself for my husband who is also a type 1. So how the things will be easier. I mean, there will not be a diabetes fatigue now we say as, okay. So there will not be diabetes fatigue because the doctor has empowered us so much. So let me just brief you about my story. I was diagnosed in a small town. Okay, there was no lab at that time. I was in DKA at that time, severe coma. Then seriously, the doctor told us कि कुछ नहीं है, just take the medicines, take the insulin injections, and your child will be good. That was the only thing told by the doctor to my parents. So what we did, ठीक है, शक्कर नहीं खाना है, done. Chocolate powder in milk, we can do it because there is no added sugar. I mean, we were not aware that I was supposed to read. I mean, my mother was supposed to read the label of the product. Okay, how much sugar is in that, or shakkar is bad for diabetes, but you can have jaggery. That was the thing. So, okay, everything was fine, but I was only 7 at that time. Till the time I reached teenage, I had this diabetes burnout, fatigue. I was looking for some kind of support, and slowly, my parents, my grandparents, they were searching for some kind of support. We came to know about Juvenile Diabetes Foundation in Mumbai. And over there, we actually understood the meaning of doctor and caregiver harmonious relations. What does it mean? What is it exactly? So over there, our dear doctor, Dr. Asgaonkar, Dr. Deepak Dalal, Dr. Manoj Bhatodekar, Dr. Aspi Rani, we don't call them sir because they are like our uncles. We always call them uncles. Dr. Anjali Bhatodekar, our dear auntie. So that's how we have grown our relations. So with their help, with their support, now I'm a certified diabetes educator. I work in mental health. I'm a counselor. So I give my service at Juvenile Diabetes Foundation on a regular basis, apart from my private practices. So now I give it over to my dia buddy, Paras.
Thank you so much, Vaishali. Hi, uh, myself is Paras Devani. As Vaishali told, like everybody generally, diagnosed at the age of early age, but I was little bit like luckiest person. I can say that. Ki at the age of 22, I got this precious gift. We can say that. Uh, yes, the same time when I got diagnosed at the time, in 15 days I lost approximately 17 kgs. In entire the diagnosing year, nobody, not a single time I have taken my insulin. I've not checked a single time my sugars, and life was going on, so on, so on. The same time, after a year, one of my one of my bestest friend, we can say that he has given me the reference of Juvenile Diabetes Foundation Mumbai, and I just went there. Alone I went there. I just thought कि चलो यार देखते हैं, we'll see what happens. Luckily I can say that कि I was the luckiest person in my life. First time I met Dr. Vijay Ajgaonkar, that is my Abba, and he said कि यार you are my jam person. I don't know what he has seen on me, but after that my life is, I can say that कि I'm a Koinur Hira. That's all from my side. Now our main topic is harmonious relation.
So basically, as I was telling about my story, initially we were told only about injection techniques. I don't remember that was technique was also taught to us. Just you have to inject your child, and you don't have to give any sugar. That was the only thing told to my parents. So it was very formal, a formal relation, like, okay, you have this problem, take this medicines, and twice a day. That was the only prescription given. So if I had any questions, what is hypoglycemia? Those education awareness was not there. That we learned hard way. I had severe hypoglycemias many times in night throughout around 10, 12 years of my diagnosis, after my diagnosis. And suddenly I came to know about JDF, and when I reached over there, Juvenile Diabetes Foundation, that was the time of our annual camp, which Dr. Anushri Mehta had already shown the pictures of. Over there, for 3 days, we will talk about different topics of type 1 diabetes like hypoglycemia, hyperglycemia, sick day. What is sick day? what will happen if your child is vomiting and you still have to give your child injection? So those tricky questions were never answered earlier. So we were given proper education, we were given proper empowerment.
Vaishali, along with that, I'm very much sure कि, Dr. Vijay Ajgaonkar has kept in mind that not only diabetes management is important, but the same time mental health support is also that much required. So almost 4 decades, Dr. Vijay Ajgaonkar has established a NGO called Juvenile with the psychiatrist. That is more like in 40 years ago, he has already thought in mind कि no, along with the diabetes management, mental health support, mental health is equivalent important in diabetes management as well.
Right. So, yes, so coming back to the story, so it was started along with Dr. Anand Nadkarni, who is a psychiatrist. He's still practicing at Thane, Mumbai. So, along with that doctor, Dr. Aspirani, they all had started Juvenile Diabetes Foundation, which gave us not only all the information, all the updates about how to manage your own diabetes, but slowly after being with Typhon, we have learned so much that now we both are capable that we can help others. So we decided to become diabetes educator from Dr. V. Mahan's Academy, and after a few years from ISPED. And now we are in that position that we can help newly diagnosed child and their parents. Being a mental health therapist, my job is mainly to work with the mothers, right? So over here, doctor and caregiver, between both of them, the doctors have very limited time nowadays because there are so many new patients coming up. Like every day when we go to our clinic, there are within 3 hours, doctor sees around 16 to 20 patients. So imagine how the doctor can build that harmonious relationship, right? So we started making a fully fledged clinic where the dietitians will be there, where the counselor, the mental health therapist will be there, diabetes educator is also there. And it's not only about diabetes, but daily dose timing and all, but even during weekends or when the child is going out, what will you do? That timing prescription is also given to to the child and the parent, right? Because that timing is different, so the sugars are going to behave in a different way. So we take care of all those things. In our clinic, we make sure that the children who has board exams, so for example, over here in India, in 10th standard is very crucial year. So we make sure to tell the child and the parent, you start coming to the clinic from 9th standard on a regular basis. Come every month with your sugars, learn about your patterns so that if your exams are in the month of Feb 2025, you have to learn how it is going to behave by October 2024. You are fully prepared. In what situation, how you are going to tackle it. So it is not only the diabetes, but different aspects of diabetes. As a team, our both phones are working 24 by 7 because we both have faced a lot that for emergency, like I had hypos and all, there was no one to support my parents, right? So I have always told, and even Paras has told that for any emergency, you all can call up at 2 o'clock midnight. So we are always available. So we get questions like, today is child sports day. The timings are different. Or the child has participated in annual day. How you are going to do? So for such small questions, they cannot rush to the doctor. So we are always available, and if we are also stuck somewhere, the doctors are always there for us. We leave a message, we drop a message, and they will 101% make sure that they will revert us back, and so that we can convey the message to the patients. So that's how we are working in Juvenile Diabetes Foundation. Right?
Even the same time, Vaishali, I can say that whenever in a professional life, I work as an assistant manager in corporate company, so I have to travel so many times. So many times I feel ki, arey yaar, when I went to Bangalore or Delhi, at that time, whenever if any emergency comes, so I'm so glad. So we have so many NGOs, so many helpers not I can say that my diabetes friends are so everywhere in Pan India we have who are ready to help us 24 by 7. It's all that.
Yeah. So it's not only me, Paras, but I'm sure Riddhi, Rekha, Harsh, they all are there for any questions, any emergencies. If we are stuck somewhere, they are there. If we are not, if we are in their area, they are there to help us out. So it's not the, I mean, the baggage is not only on the doctor's shoulders, but we are trying to share that, stress from them. Okay, okay, we are there. The way you have supported us, we are there to support other children and to help you out over here in JDF or all over Pan India.
It's like a family, we can say that.
Yes.
It's like our closer family.
So, diabody is a term we normally use very, and nowadays it's very trending. Okay. So, what is diabody? You have school friends. Okay. They are there with you till your school timing. You have college friends who are there with you till your college. You have your colleagues. You can talk to them about your office work environment and all. But the diabody, we will be there, or me, myself, and Anushri will be there forever in life, because diabetes is part of our life and it is going to be there forever or throughout our life. So, for any silly mistakes we have made or frustration, the way she said about fatigue, the decision making fatigue and all, burnout, so we can, just talk to them and it goes out so naturally. Okay, my husband is also a type 1, so we understand each other very well. For me, I have a support of these two people, and for my husband, he has support only me, so he has no other choice. It is like that. Anyways, so this is our motto in JDF, or I think in all over India, Taya, Empower T1D, everywhere in over here, Diabetes India, to help each other, learn from each other, and share our experiences. Yeah.
So, Vaishali, yesterday we got this opportunity to present ourselves in this prestigious topic, and last midnight at till 3 o'clock we prepared a presentation, full presentation. We have given this entire presentation to the committee team, and last moment we thought ki, Arey, we don't want to talk theoretically or by the presentation, but no, we want to share our own experience. So we have requested Dr. Mahira ki we want to change, something in our topic. So is that okay? She has happily requested our, she has accepted our request, and we can able to share our experience with you guys. So thank you so much.
One more announcement I wanted to make here for all our fellow Typhons about our experiences, about our challenges in life. Paras is working in a corporate office. So yesterday he got a message that he has won Star of the Quarter award. So, so basically, if you keep yourself in a good condition, if you are confident about yourself, you can achieve everything. You will not believe, yesterday morning I got a call from Bangalore, newly diagnosed kid. The mother is calling me up, the child is a teenager. Mother was very much reluctant to talk. She was I don't know from where, people comes to know that I also have type 1, and the straight question comes to, tell me your story. I started telling about myself when I was rushing because I wanted to reach here. I said, oh, I'll tell you everything, but before that, can you just do one thing? Go to our jdfmumbai.org website, read the success stories. Please go to our Instagram handle, go through the post, and then we can talk. By evening, I got a message that I'm feeling so relieved by reading all the stories, because sharing our experience is going to make a lot of difference for the parents, and which is going to reflect on the child as well with their blood sugar management. Because I've always noticed when the mothers are not in a good shape, they are stressed out, it badly reflects upon the child. So that is all from our side. Thank you to all our doctors. Thank you to Diabetes India. Thank you, Dr. Maida.
Thank you so much.
Thank you, Vishali ma'am and Paras sir, for sharing your beautiful journey and being a flag bearer of mental health in the field of type 1 diabetes. Thank you so much. So now we have a special guest, and whenever you visit a clinic or you meet any type 1, what you heard that he or she is living with type 1 diabetes or sometimes type 2 diabetes and sometimes any other. But we have a special guest or speaker. She is living with not only type 1, type 2, and gestational diabetes, and she has a wonderful experience currently. Yeah, currently she's on LADA. She's living with LADA and type 1 diabetes. Her gestational diabetes is no more, but she has a wonderful experience of dealing with three kind of diabetes, which is a unique thing, and we can learn a lot. I'm really excited. Please welcome Riddhi Modi from Mumbai, and I'm so excited.
Thank you so much, Satyam and Savita, for chairing this session. You guys have done an incredible job. Firstly, before I begin, I'd like to say I'm here on this stage only because of the unwavering support of my fellow Type 1s sitting in the audience, and a lot of them who are not here but have supported me from my journey, from my day one journey. And not to ever forget the superb support of the clinicians. Actually, many a times I've heard with type 1s that, they have faced a lot of issues with diagnosis and all of that. It's a part of the journey, but I've been really blessed with amazing clinicians who've not only handled my cases well, but they have seen that in me to be able to, have that potential to give back to the community. So thank you, Diabetes India, for having me here on this lived experience panel. Dr. Banshi Sabu, Dr. Amit Gupta, and all of you who have recognized that today there is need for lived experiences to be an integral part of scientific conferences. So thanks to all of you on behalf of the community. Normally we say that when the war is done, we have the last man standing. So in this continued collective interest of bringing the community's learnings and their sharing within each other as well as with the audience, I am here humbly the last woman standing. Not to go too much into the details of my diagnosis, but there's one line that drives me every single day, which is powered by insulin, driven by passion and purpose. And as Satyam said, I've been living with 3 different types of diagnosis in the last 20 years. Of course, my journey was not all amazing and empowering from day one. There was a lot of confusion and chaos because I couldn't classify completely into one category. Not going into the clinical diagnosis, but it started with gestational diabetes and then a few years of LADA where I thought that I could go back and reverse my condition, but not knowing that ultimately I will land up as a T1D. I do look back at some of the things that I could have done better, but I'm a very optimistic person, and today I really feel I'm so happy to be a T1D, finally, because at least I have clear diagnosis, I have a way forward on how to manage my condition, and most of all, I have a beautiful community to support me. Thanks to my community's efforts and endeavor, they pushed me, they made me learn so many things. Like, I remember at the beginning of my journey, since I'm from Mumbai, I always used to call Vaishali for any of my doubts. And then I have Lakshmi who supported me to say that you must become a certified diabetes educator. In my journey, I didn't have to face glass syringes or I didn't have to see the tougher side of type 1 diabetes. So a lot of times I did have people coming up to me and asking me, so how many years have you been a type 1? And I actually, and very honestly, I didn't know the answer because there were overlapping gray areas in my diagnosis, where for some part I was a gestational diabetic and then moving on to LADA. I don't know when exactly my LADA turned into classic type 1. But very briefly, I'd like to share that for many years, I had a good number of C-peptide, and I had very high antibodies, but I could manage with just basal insulin and oral medication. So that was a very thin line of transitioning into T1D. But I have received the best of care. So I just feel that, for everyone here, I want to give a positive message. You are in India, you're in the heart of the best diabetes care. And do believe in your community, but also do believe in your medical fraternity. Go back to your doctors whenever you feel you need to, clarify some doubts. Going forward, my induction into the advocacy journey started when everyone used to ask me, so which foundation do you belong to? And I didn't know what to answer because honestly, there was so much of information load. Of course, I'm in Mumbai and JDF is like the first point of contact. But the way I found my community friends was very organic. I just found them, at different times through social media. And I met such amazing people who've helped me in different ways in my journey. So when I didn't have an answer, I just applied to be a blue circle voice with the International Diabetes Federation. Without any judgment, they accepted me and they really empowered me. Last March was very special for me because they invited me to be a speaker for Women's Day. And it was so amazing to meet different women from different parts of the world. And we realized that, maybe we have a little less or more access to care and insulin and technology, but the challenges faced by people around the world are almost same, slightly here and there, but almost same. So it's been very humbling to be part of the global advocacy groups as well. My special interests lie in fitness and mental health, and there's a lot of learning related to type 1. I'm so happy and excited that this year Diabetes India invited me to present my first oral paper on fitness and my learnings. And I hope that I give back to the community in many more ways. With that, I'll just go back to my main topic, which is empathy and mindfulness when it comes to type 1 diabetes management. These are just a few lived experience insights. I know a lot has been spoken by so many of our beautiful T1D members here. So I won't go into the repetitive part, but I'd love to go through this briefly. So what exactly is empathy and why does it matter? It's not just the doctors, but it's anyone and everyone around you who needs to understand you as what are you going through in your journey. When it comes to diagnosis, recognizing, responding in a positive and a compassionate way, building an emotional connect, and developing strong, meaningful relationships. That's what we thrive on. What happens when we all get diagnosed? We have a 4-step journey that starts with denial. Oh, why is this happening to me? It can't happen to me. There's a lot of resistance. It takes often very long to get to the stage where you start accepting that you have a condition. And then finally, today, I feel grateful. I'm so grateful for this diagnosis so that I can, really find my real purpose in life. So we go through a range of emotions. Why does it matter? Because we often get judged. So many people around the world have been judged for eating sugar or having a nice soft drink because they live with diabetes. We have faced often a lot of stigma. Mental health challenges are faced at every age and stage. A child is lost in diagnosis, often facing bullying, teenagers dealing with hormones, mood swings, bias and stereotyping, young adults, trying to find their worth in the society as well as establishing their careers, looking out for understanding partners, and, trying to balance everything in life. How do we relate it to type 1? Taking injections in public, explaining your condition, sharing about the differences between type 1 and type 2, the word diabetes, stigma. You don't look like a diabetic. I've been asked that hundreds of times. What does a diabetic look like? A diabetic is nothing but just a person living with some sort of diabetes, trying to find a place in this world without getting judged. how our attitude matters and how everyone around us, their attitude matters. Often the way we speak can be empowering or discouraging. Today, if I want to present an oral paper, if a clinician comes up to me and says, yeah, definitely you can do it. If Vaishali wants to come and share about her life journey, and I would say, Vaishali, you're going to be amazing. That's what it is all about. We are here to support each other, make each other feel amazing. Poor communication can often leave us feeling very hurtful, and many a times we have built and see negative stereotypes. Very often I used to get asked like, so where have you been all these years if you were a type 1? I was solo tripping. I didn't know where I was. And I was lost in this whole 3 different types of diagnosis. But here I am. That's what matters, not my number of years of experience. What is my passion today? What is my purpose today? I think that's what really matters. So we have to break these stereotypes. So there are 3 vantage points according to me. How the healthcare professionals speak to us, that really matters. Our parents, our family, our friends who don't understand different types of diabetes, how they speak to us. How media speaks about diabetes, how social media speaks about diabetes. Very often, all of us here from different support groups have social media posts, stories, and campaigns. What are we trying to do there? We are trying to give a message to people without diabetes to understand us. I think our whole purpose is just that people around us can understand us. And that is why our community and support groups are very, very important. What does our community and support groups do? They help us to build safe and vulnerable spaces. Just like Dr. Anushri very rightly pointed out that we do our madness together. While we all look perfect, I've been trying to be, the perfect MDI doser from Sumit here. And we have our unicorn moments, but there are times where we are treating hypos and hypers at the same time and laughing about it. So that's where the community and support groups have been so important to us. Going to the next part, which is very, very important, is mindfulness. Like looking into my own journey, what has really helped me? So today, a lot of type 1 fellows know me as a marathon runner or a strength training fitness ambassador. But that's not where my journey started. My journey started with just walking, because I was trying to reduce my blood sugar levels without understanding correction doses. Back in the day, I didn't know the concept of correction doses. So whenever my blood sugar went high, I just left my house, I went down and I started walking. Very often the walks would be from 30 minutes, 45 minutes, 1 hour to maybe 90 minutes. And that's where I felt that that was this isolation that I lived in. And many a times, I have resorted to yoga just to help me with my breathing to get over my emotions. But when I look into the present moment, I'm so beautifully be able to synthesize my past learnings into the present context. So what exactly is mindfulness? Being here, being in the moment, engaging with yourself, with your surroundings, with a non-judgmental and grateful attitude. Recognizing your thoughts and feelings. Practically put, when Sumit was giving his presentation, while I was very much here, I was very concerned about my rising blood sugar. What am I going to do about it? Just accept it and say that, oh, I'll do a bad job on the presentation. No, I'm just going to get up, go take a correction dose and come back, because that's what I need right now. So mindfulness often flows into self-care and self-love. So let's talk a bit about, is self-care or self-love, selfish? No, it's not, because many times type 1 and many autoimmune conditions have a very strong link with emotions. Tahir spoke about resilience. So when we talk about building physical resilience, becoming stronger, what we also need to do is we need to build on our emotional resilience. And how are we going to do that? See, there are 5 pillars of diabetes management. Very often we speak about 4 pillars. What are the 4 pillars? We all know medicine, which is insulin, meal planning, monitoring, and movement. But my most favorite pillar and the most less, I mean, you can say less talked about is mindfulness and mental health. Let's say we have access to everything. We have the best of insulin, the monitoring techniques, and, like the best of technology. We have the means to exercise. But what do we do if our mental health or motivation is not on point? So we realize that that one is a very integral piece in our journey. What do I often do when I feel overwhelmed? There are times where I had juggled my corporate work and my assignments, trying to balance family life, trying to balance parents, in-laws, assignments for school with my child. And I was really overwhelmed. And at the same time, you're dealing with hyperglycemia, hypoglycemia, the social pressure of living the urban lifestyle in a fast-paced city like Mumbai. So my quick, technique that always helps me even today is the 4 Ps. Pause, reflect, understand what you need, ease the pressure, just relax in the moment for 30 seconds, slow down, prioritize what needs to be done right now. Like I just got up and I took my correction dose. That needs to be done right now. Now feel peaceful, let go of all your control. Coming to type 1 diabetes specifically, the 4 Ds have always helped me. When I started training for running, like I have my fellow diabuddy here, Lakshmi, used to send me voice messages every morning on how I can start my running journey. I have never been a runner, but thanks to his mentoring and support, he's made me run 10K marathons. Yes, you need the discipline, the dedication, and the determination. But being safe is very important. You mustn't forget that diabetes is also a delicate condition. So there are days where you're overwhelmed with your current health situation. Just slow down, let go, don't go for a run, don't take that pressure. So it's very important to realize where you are today because every single day is different. What is the self-love journey all about? It's building resilience, confidence, and a positive relationship with ourselves. I know many type 1s when they are young, they feel, oh, how will I find a suitable partner? Have you ever tried partnering first with yourself? That's something which is a great takeaway for this topic. I realized that it was high time I built a positive relationship first with myself. And how does that go about? First, you need self-acceptance. Yes, I am what I am without judgment. Yes, at times I'm a bit vulnerable. At times I'm a bit emotional. At times I'm a bit hurt. Giving yourself that compassion, the kindness, the peace and the patience that you deserve. Realizing your self-worth. I can tell you that every single person sitting in this room is worthy of something. Understanding what you're worth of is what will happen if you self-love on this journey. Every time I used to call up my diabuddies and say, what can I do for the support group? Because they are already existing entities, their hands are full with lots of work going on at the grassroots level. Yes, at a time I can't support 200 children, but maybe I can just write a letter for you to the Prime Minister to say, let's work on reducing insulin prices. I used to call my support group friends, okay, can I just draft this letter for you? I know you're really busy today. So realizing your worth, finding your place, that really makes you feel empowered. Today when I meet my friends, they all are quite appreciative. They make me feel really loved. And when you realize you're getting burdened, like there are days when some of our support groups are getting 10, 15, 20 calls from moms asking about correction doses. So what do? Take a step back, tell your partner and say, can you handle this for me today? Today I'm already overwhelmed. So make self-care a very important thing in your journey. And then forgiveness. On days you may make mistakes, you may do something wrong in your own dosing. Forgive yourself. What are the mindfulness techniques that we can apply specifically to T1D. Observe your patterns, record your data, look at what are the improvement areas, look at your own goal setting, focus on meal planning, ask for help. I think everybody said that. Ask for help. Go back to regular diagnostics. Don't become overconfident. You are not the doctor, even though you're the diabetes educator. For a woman in her 40s, what is important is for the doctor to see things from like a little higher level. Maybe there are other issues, maybe there are gynec problems that they can anticipate. That's where you need the assistance of your doctor. Your regular diagnostics are very important. Sharing your best practices with your fellow diabetes, providing support to each other. And how do we do that? That's what these mindfulness techniques are all about. In a busy day of 24 hours, can we spend 10 minutes reflecting on what we can do to better our life and what we can do to help others around us? So the key takeaways are, yes, diagnosis does come with a lot of burden, management, emotional disturbance, and fear of the unknown, but empathy can help. Stigma, discrimination, judgment is there, it's real. But how can we overcome that? By being more mindful, making sure our mental health is in place. Engaging in mindfulness techniques, helping yourself and helping others. And community support groups play a large role in long-term management of type 1 diabetes. So with that, those are the two pictures of some of the activities we've done. I have many such pictures, but those are just reflections of how large groups of people have come together because of their diagnosis, and they have been unrelentingly supporting each other. With this, I would love to thank my community. And I am here, and I just want to say that while I'm in Mumbai and JDF is there, but I'm available to anyone, any part of India, any part of the world, because I belong to the type 1 community. Thank you so much for having me here. And another thing, just my personal mentors who really helped me on this journey, they are not here today, but I'd like to thank them on this platform. Harsh, Prashant, Lakshmi is here, and Sahil and Mariel who've helped me with my fitness journey. And there are so many incredible people. It's so difficult to take names, but yeah, wherever they are always a part of this whole community and fraternity. So thank you so much. Sorry about overshooting the time.
That's okay. Thank you so much, Riddhi, for taking us through the journey of mindfulness and especially self-love. So what I learned from Riddhi today is, since we all are surrounded by the doctors, healthcare professionals, our families and friends who've been part of our journey, let's have this motto for today. Let's pay gratitude to all the people around you today who've helped you in your journey. Doctors, healthcare professionals, family and friends. So today, since we are together, let's do that. Now I would like to request Shraddha and Saurabh to please join us on stage and guide us through the partnership goals and how they have been partners in crime.
So after this session, I request everyone to come in Diabetes India Hall, as we have very important session on type 1 diabetes only from Dr. Sanjay Datta, Breakthrough T1D, and he is inviting all of us. Thank you.
Everyone. Okay, good day, everyone. So it's an honor to be here with this lovely community, standing before you as someone who has been through the ups and downs and being one of the critical cog in a type 1D couple for over a decade now. Pardon me if I'm not a good speaker, so there will be some fumbles. For for introductions, I'm Saurabh. I'm a cybersecurity professional and a passionate cricketer, like any other Indian. I'm here with my best friend slash consultant slash support system slash counselor slash diabetes slash partner in crime and whatnot. And mind you, this is the same person, a one person, my beautiful wife, Shraddha here. So over to you.
Thank you for that appreciative words. I was quite surprised to hear that. Hello, everyone. Just a quick introduction and conscious about the time. My name is Shraddha. I'm a HR professional. I'm a yoga enthusiast, a dance lover, and a type 1 diabetic since last 24 years. 17th of February 2001 is when my life changed. I didn't know then whether it was for good or not, but tomorrow, 17th February 2025, it's my 24th anniversary, 24th, 25th anniversary. So I would like to give myself a tap on the back for doing quite okayish. Sometimes good, sometimes not so good. I'm here, we both are here to talk about our experience to live as a type 1 couple. And we were invited by Dr. Bansi and Dr. Mahira and team to share our experience. And we thought we'll take this opportunity to let everyone know. And in case if that is quite inspiring for anyone, we would be very grateful. We met in 2013. We got married in 2014 as a couple. We are doing great. We are together in each other's highs and lows. Talking about India as a country, we still have got that taboo. When you have your daughter or your son getting married to a type 1, the parents will definitely feel a bit reluctant. I would like to take you guys a little back. When my parents were looking for a groom for me, they were like talking to relatives to find a suitable match. And whenever they share my pictures, the first reaction came back to me was, "Oh, you don't look like one. What does it look to be to looking like one type 1 diabetic?" So that's how it all started, and I'm very grateful to God, grateful to the universe that a random Facebook message will end up here. This guy messaged me on Facebook years back. We started interacting, we started liking each other, fell in love, we got married, and it's been 10 years. Our journey so far, I would like my husband to take you through the next slide deck.
Okay, I just want to share a story. I mean, some time back I was in with my doctor, Dr. Bansi Sabu, and we were sitting there waiting for our reports. And there was a lady sitting there, and she was worried, of course. She was accompanied by her 9-year-old daughter, and it was a freshly diagnosed case of type 1 diabetic, and they were waiting for the reports. So Dr. Bansi asked us to go and talk to that lady. We went there. We started talking, and she was obviously worried, but the greater worry was she is a girl. How will she get married? And I was shocked because it's still a taboo in our society. We talked more, we had a good conversation there, and we were the living example of that. So I told that lady that we are married. It has been over a decade now. We are happily married. We are enjoying everything in our life, and we are successful. She is working as an HR professional. We have traveled across the globe. So don't worry about that. Just think about the giving the best of education to that girl, to that kid, and ensure that she doesn't lack that confidence. And that is very important in our society at the moment. Coming back to our story. So as Shraddha said, I mean, it has been over a decade now. I would not deny that it has been all very easy. It has been difficult on the days where there was burnout of being type 1 diabetic, both of us. But the good thing to have someone as your partner, a type 1 diabetic, we can understand each other just looking in each other's eyes, what we need at that moment. If her sugar is going low, I can understand she needs something, she needs some tablets, and we have celebrated our highs, not literally highs blood sugar levels, highs of our success, and we have always celebrated our small wins. uh, there will be days where you will do the hundreds of things right, still this will beat you up. So you have to be patient with that, you have to be very resilient with that. So any wannabe couples or any couple living with that, if you think that this is something taking a toll on you, just be supportive to each other. Just live, uh, love, love, that support system, that care. It will help you to defeat that type 1 diabetic. So I mean, obviously, we started dating, we had dates, and still when we go outside, we plan some dinners or everything. Our bag is all uh, filled up with all these sugary things because we have to ensure that we will whatever we are going to enjoy, it is not coming in between. So that has been the life, and trust me, it's a lovely life. It has been a superb journey so far, and I hope it will be the same way going forward. Uh, we haven't made a lot of slides because yesterday only we got to know that we have to make some slides. So this, from our experiences in last 10, 12 years, we have gone through situations. And as everyone said before us, that the key thing is to communicate. Talk to someone, get someone as your dia buddy, because there will be scenarios where you will be fed up of all these this type 1 diabetic thing. In those situations, you need someone you can go and talk to. Luckily, I have got someone in my home itself, but you have to find your that someone. Shraddha?
Um, so as you can see on the slides, we have got some points which we thought will be very helpful for the future couples, future type 1 couples, be only one partner is type 1 or both the partners are type 1. So understanding, as my husband clearly mentioned, understanding each other is very important. We have managed each other's horrible hypos and crazy hypers. Days were not easy, but be patient. Take one day at a time and celebrate the small wins of that particular day, is my learning from the journey so far. Making small or big lifestyle changes. As I mentioned, I'm a yoga enthusiast. He likes cricket, he likes gymming. So we do encourage each other to, just go for that thing which you like, make some fitness goals, and we again compete with each other literally, that देखते हैं आज इस बार किसका HbA1c कम आता है. So that's how we encourage each other, to fight our diabetes on day-to-day basis. Planning for the long-term health, very, very important is this one, and my favorite. I love planning things. Planning for your long-term health, especially in type 1 diabetes, involves your lifestyle changes. It includes your financial, making the finance adequate so that you can survive for the next 5, 10, 15, 20 years, whatever, depending on your financial situation. And also it does include the mental support. Here we are not talking about how much insulin dose he is taking or how much I am taking. Here my lessons or our lessons is more about support, understand, plan better, make your mistake today, and plan better for your next day tomorrow is again my learning. Date nights with insulin. I do remember we're getting ready, we are just about to step out, one or the other is going low. Oh, let's wait for 5-10 minutes. So we wait. We have missed so many movie beginnings, and I cannot tell you.
and which is okay. We have got Netflix now, so we can just go back and watch the same movie 10 times. So that's completely all right. We have traveled across many countries in Europe. We have traveled. Traveling also includes type 1D planning. So that's how we um, ensure our bags are filled with our supplies backup. My diabetes has taught me all the things in my life, be it stress management, be it backup plans, be it mindfulness, be it mental health, or be it finance, anything. Whatever things I have learned in my life, my diabetes has contributed immensely in that. And humor is your best medicine. Believe me, when we started living together as a married couple, for the first few months, for a couple of years, things were not easy. But now we have learned that art of laughing over our mistakes we made in the past, like type 1 mistakes. So, humor, make each other laugh, talk to each other, and if you cannot give suggestions, sometimes you just have to listen to your partner, and that's what we have learned, explored, and we are still evolving as a partner. We are still evolving. So that's about our pointers, and I'll take this platform to say to my husband that you are most important person in my life. You are a lot like my insulin, and I can't live without you. So that's how our journey has been so far. Celebrate the small wins and take one day at a time is my mantra to take this disability or this type 1 situation, whatever. Had it been the other way around, I don't think so. I don't want it the other way around. Whatever I am because of my diabetes. And had it not been diabetes, I wouldn't have met this wonderful human being who is always at my back. He's my strong support system. So thank you.
Thanks, everyone.
Thank you so much, Shraddha and Saurabh. So, Shraddha, I would like to add, you've missed all the movie beginnings, but all the movies always have a happy ending. So, definitely, we all have happy endings. So, thank you everyone present here for this wonderful discussion, for being here, for your time. Had a great time, had a great learning, and we all have good takeaway lessons. And I request you all to please join us in the other hall. There's an important session going on. Yeah. Please,
There was, Apple founder Steve Jobs. He once told in his 2008 speech, like, you cannot connect the dot prospectively. You have to connect it retrospectively. When I got this particular speech, and you have, come across all the stories, these all are retrospective. So don't think in that way. Definitely do your job, and we'll find it later.
we all can.
Can you please come for group photo? Wait. Come on. Good. One more. One more.